Hello and welcome to the Multicultural Media Online Conference. This forum is hosted by the Ministry of Health, New South Wales Multicultural Health Communication Service with the Multicultural New South Wales. I'm Jesusa Helaratne, you can call me Jess. I'm the Deputy Director of the Multicultural Health Communication Service and I am your moderator for these sessions. We have with us this afternoon, of course, Dr. Jan Fizzell, our Senior Medical Advisor for New South Wales Health, who is with us to provide updates on COVID-19, influenza, and other public health matters. And today we're so pleased that we have our special guest, Professor Charlie Benrimoj, who is one of the chief investigators in the trial in New South Wales Government Community Trial, Pharmacy Trial. Professor Benrimoj was head of the Graduate School of Health, University of Technology in Sydney, and he was the foundation professor of pharmacy practice, and he's joined us today to talk about the community pharmacy trial in New South Wales. Before we start, I'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. I am joining you from the land of the Darug people. We pay our respects to elders past, present, and extend that respect to Aboriginal elders and colleagues. We'd also like to acknowledge the elders and leaders from all multicultural groups represented in this session today. We'll do our best to answer all your questions. Please ask them and comment on the chat and share your thoughts with us during the session. We always want to hear your thoughts with us. And please keep your microphones on mute. My colleagues from the Multicultural Health Communication Service will be adding links on the chat and resources with information available in multiple languages and health initiatives that you can download from New South Wales Health, MHCS, and the New South Wales Government websites. So thank you again for joining us. I'd like to now ask Dr. Jan and Charlie, or Professor Benrimoj, to join us for the questions. Dr. Jan, Charlie, thank you so much for joining us.
My pleasure. Thank you very much for inviting us.
Thank you. We'll start with Dr. Jan. Dr. Jan, cases of COVID-19. What's the situation in New South Wales?
Look, we have seen quite a good going wave of COVID-19 with a number of more people being admitted to hospital. So it's important that people remain vigilant during this current time. We know that we've changed how we're testing for COVID in New South Wales. You now need a referral from your doctor for a PCR test. But please remember that those free rapid antigen tests are available from lots of different locations, lots of community groups, libraries, Service New South Wales centres. So please, if you do need those tests, they are still readily available. You can find a free RAT near you at the New South Wales Government website. If you're at higher risk of severe illness from COVID-19, we'd like you to keep that plan up to date. That plan should be about when you need to be tested, maybe having a referral in your pocket from your doctor for testing advice. If you can't contact your doctor and you've got symptoms and you don't have a RAT at home, call Health Direct on 1800 022 222 or use the online service finder to find a GP near you. They can help you sort out a referral for a test and, if you're a higher risk person, treatment for COVID-19. It's circulating widely in the community, as I said, so protect yourself and your loved ones. And that means stay up to date for your vaccinations. For a lot of people who had COVID during the Christmas time, we're now heading towards 6 months since Christmas, and so it's time to get your COVID booster if you're in those eligible age groups. It's important to stay up to date with those immunisations because we know that even if you've had COVID, that mixture of having had COVID and being immunised gives you stronger protection than either having had COVID alone. And again, we don't want you to get COVID for this, but you know, COVID plus immunisation does seem to give us some good protection, but don't get COVID if you can help it. It's really unpleasant, speaking from my own personal experience. If you do get symptoms, do stay home. It's really important that we don't spread these diseases around the community. Do get tested, wear a mask if you're going into a crowded indoor place, still worthwhile wearing it on public transport, particularly while we've got winter germs circulating. Talk with your doctor and make that plan for antiviral medicines. And again, if you've got symptoms of respiratory illness, if you've got a sniffle, if you know that someone that you're really close to has just been diagnosed with COVID, put off going and seeing people who are elderly or who may have just had cancer treatment or who may be otherwise unwell, so that you don't accidentally give them COVID-19. You really don't want to make the people that you care about sick.
Yes, and Dr. Jan, COVID-19 as well as influenza, which you have the banner right behind you, is influenza is serious, and I'm recovering from influenza as well, from the flu, and just how crucial it is to make sure that you stay at home if you're unwell, and to keep the community safe. And also when you get your vaccinations, you can actually go to the pharmacy as well, isn't it?
That's right. So one of the things is anyone 6 months and older, it's time to have your flu booster if you haven't had one this year. Flu is serious. We do have young, fit, healthy people in ICU each year on heart bypass because of flu. So it can happen to any age group, but it's particularly for older, if you've got a chronic illness, and if you are pregnant, those vaccines are also available for free under the National Immunisation Program. There may be an administration fee, but generally those vaccines are free for you. For other people, they're available at low cost. And yes, community pharmacy is one of those destinations where more and more vaccines are becoming available. And so it's a definite place where people can get up to date with their vaccines, talk to their local pharmacist. And if the pharmacist can't help them then and there, the pharmacist can either give them an appointment to come back for that vaccination or let them know what they need to do to get vaccinated from their GP.
Thank you, Dr. Jan. Professor Benrimoj or Charlie, thank you so much for coming on today. And I'm sure a lot of people would like to ask questions about the role of pharmacists and how important your role in making sure that the community is safe and the pharmacists are trained and are able to provide advice.
Yeah. Well, look, thank you very much for inviting me, Jess. Look, I think it's really important to recognise that the community pharmacies are in every suburb, in every town, in every city, and usually you have a pharmacy within probably 10 minutes to 20 minutes from where you are. So it's a healthcare professional that you don't need to make an appointment, so that you can just come up, go to the pharmacy just to ask for specific advice, or increasingly so to provide services to you. For example, we've just been talking about vaccination. So pharmacists now are trained both to give influenza vaccine and to give COVID vaccine. And as part of New South Wales programs, we are involved in some very exciting new trials over the next 3 years. One of the trials that's really has just started, we're doing a feasibility study in 100 pharmacies where particularly women, young women between the ages of 18 and 65 can come and present symptoms associated with urinary tract infections. We know that urinary tract infections or uncomplicated urinary tract infections need to be treated very quickly. So if you have any issues about accessing your GP for a visit or anything like that, please don't hesitate to go to find a pharmacy from the New South Wales register, and then you can find the pharmacies, one of the groups that can provide these services to you. All these pharmacies are trained as part of our trial. And also as part of the trial, there'll be a follow-up with patients that give us consent to ensure that this patient's safety, etc. I think one of the other big advantages of community pharmacy is that we're multiculturally diverse. You know, most suburbs, you know, if it's predominantly of one culture, you invariably will find that the owner or the pharmacist working in those pharmacies will be able to speak your language, they'll understand your culture. So don't hesitate, if you've got any issues associated with your health, to pop into the pharmacy and ask them. They'll be able to either provide a service to you or direct you to the right place so that you are looking after yourself properly.
Thank you so much, Charlie. And if you have any questions for Charlie and Dr. Jan, please do so. I have a question. Dr. Jan and Charlie, this for community pharmacy trial is so important because it's also providing the opportunity to gather information and data so that we can address the needs of the community further. Dr. Jan, in terms of why is it important that we should be encouraging people from multicultural backgrounds to participate in this trial? And I'll go to Charlie as well later after Dr. Jan.
Look, I think one of the things is a lot of people from around the world are used to pharmacists providing different services depending on where you are. And so if you say came from the UK or Canada, you'd already be fairly familiar with your pharmacist providing this sort of urinary tract service, also New Zealand. So it's important that people understand that whilst pharmacists may have slightly different roles in different countries and be able to provide different medicines, that when people are able to do things in Australia, we make sure that it's safe in Australia within our own health system. But pharmacists are really accessible. It's not unusual for a woman with symptoms of urinary tract infection. So that can be that sort of burning or stinging or pain when you have a wee. It can be the fact that you need to go to the toilet more frequently. Sometimes if it's getting worse, and this is where the pharmacist will help you understand whether they're the best person to treat it or someone else, you can get pain in your back or you can get high fevers. Now, some people will need to go and see a doctor or may even need to go to an emergency department. And so we've been working with our pharmacist partners as well as with doctors to make sure that people with those symptoms of urinary tract infection are getting the right care from the right person at the right time. And those pharmacists are, you know, they're often the first people that people go to when they've got these symptoms because they are so available. And it'll be really exciting to be able to roll out this trial and have some safeguards there to make sure that we do get that intersection with people getting that holistic care, where the pharmacists are providing care, the GPs are providing care, and those GPs and pharmacists are talking to each other and making sure that the patient who's at the centre of that care is getting that good care.
Just to reinforce Jan's views, look, I think pharmacists are very conservative in the way they treat treatment. The most important thing is to make sure that patients are treated effectively, appropriately, and as quickly as possible. With UTI infections, you know, they can develop in a bad way very quickly. So it's very important for people, if they have the symptoms that Dr. Fizzell has just gone through, is that they go and seek medical attention. Now, I think the big advantage the pharmacy has is that you don't need to make an appointment. You just can go in there, you can ask. The pharmacist will ask you some questions. He will collect some data because we need to collect data to make sure that everything is safe in terms of the patients. We will communicate with the patient's permission. We will communicate that information to the doctor so that everybody's aware of what the patient is receiving. But the pharmacist will spend, you know, up to about 5 to 10 minutes with you, asking questions, finding out that your symptoms are due to a UTI. Then they will provide you treatment. Sometimes that treatment might be an antibiotic treatment, but they also will give you a lot of information on how you can prevent it in the future, whether if the symptoms are not clearing, what you need to do, or in some cases when the pharmacist believes that it's more important for you to be seen by the GP, refer you to the GP as quickly as possible, or in those extreme cases, you know, maybe even send you to the emergency department straight away so that your health is of paramount and you don't get into a complicated situation. It's really important that, you know, as part of the interaction with the pharmacist, you provide them information. It's all going to be done in a confidential way. And that will then help you make a decision as to what you should be doing next.
Thank you, Charlie. And as you see on the chat, there are some links to resources in language and also information about the clinical trial. I have a question in terms of, you know, COVID-19 is here and the information that you're able to provide as pharmacists as well to, in terms of the safer use of medicine that's available for antivirus as well, isn't it, Dr. Jan?
Yeah, and I think this is one of the things is that we know that some of the antivirals can have some side effects. They can give you a bit of a funny taste in your mouth. And checking in with your pharmacist to see whether those side effects are normal is a really good way of checking in to make sure that everything's okay. But the pharmacist can tell you how to take the medicines, because they've got slightly different medicines at different times of day, depending on which one you're prescribed. And also your pharmacist can also make sure that you know the importance of completing that medicine.
Yeah, look, it's as we call it, adherence to medication is really, really important. So, you know, when a doctor prescribes you a medication, they're obviously prescribing it to, you know, perhaps treat a chronic disease like diabetes or hypertension. And it's very important that you keep taking that medication, that you don't stop taking the medication. But equally, in very rare cases, those medications do have a side effect. So if you have any symptoms that you think are different or are worrying you, you know, do pop into the pharmacy, because they'll be able to provide you all that information. The consultation normally doesn't cost you any money, so that you can talk to them, and in a few minutes you can allay all your fears. Or if there's an issue, then the pharmacist can refer you to an appropriate face to deal with it. So a key message is take your medication as being prescribed by your doctor. If you've got any queries about your medication, be them antivirals or anything else, don't hesitate to go to the pharmacist. You know, pharmacists, their training is on medication, so they're experts in medication, and they can, you know, they're accustomed to talking to people, they're accustomed to giving you information. So please use them as often as you really require to.
Yeah, thank you so much, Charlie. And Dr. Jen, actually, I went to the doctor yesterday, and I also went to the pharmacist, and I wanted to find out what's the difference of some medicine that I can't take and can. And it was really informative, and I got the information that I needed. With the clinical trial that you're doing right now, what is expected, and when is it going to run, and what programs could be expected aside from UTI, and what other medical treatments could be expected in the future?
Right, well, let's take one question at a time. In terms of the UTI trial, at the moment, we are just testing our systems to make sure that everything's safe and working well, and we're testing them in about 100 pharmacies. As I said, you can go to the New South Wales Find My Pharmacy, and you'll see the pharmacies that are providing that service. In a couple of months, in about July, when we finish the feasibility study, we've already got about 1,200 pharmacies that have expressed an interest, and then, you know, they're currently undergoing training. So in about July, that number will increase tremendously. And again, you can find them in Find My Pharmacy. If not, when you're popping into the pharmacy, you will see some signs in those pharmacies that will tell you that that's the pharmacy that provides the service. Okay, so, but even if a pharmacy doesn't provide a service, please, if you've got any concerns about your health or UTI, don't hesitate, because if they're not providing the service, they can either refer you to a pharmacy that does, or can refer you to a GP. So in summary, about 100 pharmacies around New South Wales at the moment. In about July, there'll be about 1,200, which is about 60% of pharmacies there. So that's the UTI. At the same time, because we really are very interested in making sure that people access health, we're going to be testing some other areas, and the next one online that's been decided is oral contraceptives, and all the details haven't been worked out just yet. It's likely to be that if once a doctor's initiated you for an oral contraceptive and you've got a prescription for it, and that prescription is, say, within 2 years, then you can actually go to the pharmacist and they'll be able to supply you, after chatting with you, an oral contraceptive. And you know, that's likely to be happening in July and August as well. And the last set of conditions will probably be a range of skin conditions, and that will occur in October. Now, once we have the data and we're 100% sure that that's safe for the patients and that people can access it, etc., then it'll be up to New South Wales Health and the government, depending on the report we produce, to decide whether those services will continue or will they be expanded somewhere else.
Thank you very much, Charlie. And Dr. Jan, this is an important initiative that New South Wales Health has undertaken.
And I think it's a real credit to our partners at the University of Newcastle for the work that they're doing, because one of the things that we're doing in New South Wales, which is a bit different to what's happened elsewhere in Australia, is there's a process that we call co-design, which is where our university partners are working with the clinicians, the pharmacists, the GPs, us as a health service provider, as well as the community, to design a service that actually works for people where they are and when they are. And that's when we get the best outcomes, is when we all work together. And I think that's one of the things that we're working really carefully to do. We also know that sometimes people are nervous about new services being introduced. And so trying to make sure that we put the right safeguards in place so that we can understand if there are issues, so that as we proceed forward, we can make sure that we're addressing those issues in a way that look after people. So, you know, there are some caveats around what we're doing in New South Wales. It's about making sure that we're starting, if you like, in a conservative way. And then as we show that things are good, safe, appropriate, then, you know, we may see a much broader expansion like we've seen overseas. So we just need to make sure, though, that with each step that we take, we're filling a need for the community, that we're making sure that the right people are providing the service, and that there's really good ways of making sure that people can see whoever they need to see at the right time. So it's about making sure that we've got the right care for the right person, right place, right time. And I think pharmacy is an excellent place where there is so much right care for people being given, and we can keep giving more right care in that setting.
If I could add to that, I think it's really important to work in a collaborative nature. I think we know that when healthcare professionals work closely together and closely with the consumers of any background, then you get much better care. And, you know, one of the key principles that we have as a research team is to ensure that we're working in a collaborative care, in a collaborative sense with doctors, because, you know, doctors are very important. That, you know, we need to make sure that they're informed of what we're doing with patients, and we need to make sure that the patients are pretty well informed. So, you know, part of our protocols ensure that we communicate with the doctor, obviously with the patient's permission, and secondly, that we provide as much information as possible for people of different backgrounds so that they can actually understand the process they're going through, and very importantly, understand that that they're getting better, and if they're not getting better, then they should act pretty quickly.
Thank you, Charlie, and thank you, Dr. Jan. And that's exactly the question that I was going to ask in terms of the GP and the collaboration with GPs and pharmacists. Because for the people online here today, especially for the multicultural media, I think what kind of messages are we important to share to the community about that collaboration?
Yeah, look, basically, we've been working with the medical and pharmaceutical organizations very closely. One of the things that we need to develop are things called clinical management protocols, which really set out when we need to refer patients, how we need to communicate, etc. Now, as Jan mentioned, we're very keen for pharmacists and doctors to work together. So part of the process is when a patient comes to the pharmacy, if the pharmacy is going to treat them, with the patient's permission, is to pass that information to the doctor, so that your doctor understands what treatment you've received in that particular occasion, because, you know, having a complete health record will make decisions much better. So from the perspective of the doctors, there is a requirement for the pharmacist, with the patient's consent, to pass all the clinical information to the doctor, so the doctor's got a good clinical record in terms of the treatment for that patient. From the point of the designing, we've included consumers in the process to make sure that whatever service we are participating or providing is acceptable for the patient, which is really important. And that process, as Jan's described it, we call it co-design, when we got all the partners together and we'll work out exactly what the service is, when the patient should be referred, what information should be given to the patient. So everything's done in a very systematic way. And we know that if that happens, then we get much better health outcomes for patients.
Thank you. And Dr. Jan, you've seen patients, you understand patients, but and also how should we be encouraging people to join clinical trials like this? And I asked this question earlier for multicultural communities, because we see not enough participation from different groups.
That's right. And look, being in a clinical trial, you do sometimes need to do a little bit more paperwork. So it can take a little bit of time. But that paperwork helps us get what we call consent, which means that you understand that we're doing some research in different languages, so that we can make sure that people from different communities are able to be a part of this, so that the service can be provided to people from different communities. But if you are invited to be part of a clinical trial, we know that generally people participating in clinical trials tend to have better outcomes than people who don't participate in research trials. And there's lots of different reasons for that. But one of the reasons is that when you're in a clinical trial is we pay really close attention to what's happening to you. And even if you're not getting, in this case, everyone's getting the care package and we're evaluating the care package we're giving to people. But sometimes in hospital, you may be asked to enroll in a trial where you may get a particular treatment or you may get a different treatment. And whether you get a brand new treatment or an older treatment, we know that people do really well because they get that extra observation and that extra wraparound safety. So it's worthwhile, if you're invited to be part of a clinical trial, taking that time. And if you're concerned, asking your doctor or whoever's talking to use the telephone interpreting service, because that's available to pharmacists who are talking to you about your medicines and things in the community. And it's also available to clinicians in hospitals. So don't write it off as too hard. And also, if you're interested in being part of a clinical trial, do bring it up. Because sometimes doctors may be hesitant to think, oh, the paperwork will be hard or something else will be difficult. We're trying to break those barriers down within our healthcare system, but also for people to be their own advocates, to be part of research is really important. So it's important to ask about research. Is there something I can be involved in, no matter what treatment you're having?
Yeah. Thank you, Dr. Jan. And Charlie, was there anything you wanted to add?
Yeah, no, look, I think involvement in this UTA trial is very simple. It's not going to take you a lot of time. Obviously, the pharmacist will ask you a few questions before he or she decides what management is best for you, whether they can offer you a treatment or they can offer you an antibiotic, or you need to be referred to a GP, or in those rare cases, referred to the emergency department. That will not take much time. The only follow-up we're doing is again, with your permission, with the patient's permission, is actually phoning them up 7 days after they've received the treatment. And, that interaction will take, again, we estimate between 5 and 10 minutes, asking a series of questions just for us to measure whether what's happened has been successful or not, or whether you've had any issues, etc. So in all, in the UTI trial, as well as in the oral contraceptive coming up, the amount of investment in your time is minimal. You will not have to pay for the consultation with the pharmacist at all. You may be asked to pay for the product as you would normally in terms of when you get a prescription, but there'll be no cost to you in terms of participating. So it's easy. And we do encourage people of all backgrounds to get involved, because the more people with different backgrounds, the better we can ensure that the systems we have in place are safe for all the community. It doesn't really matter what culture or what background you are. You know, there's equity in all this, and we want to make sure that the service, it reaches everybody in a great society, in a great multicultural society like we have. And the big advantage is that it's very likely that the pharmacist that you're going to go to will be able to speak in your own language in many cases. And if they're not, we're also providing some multicultural training for them so that they meet all the cultural sensitivities. So please don't hesitate that if you've got any of the symptoms associated with urinary tract infection, as Jan has previously said, go to your pharmacy. It'd be very quick, and then we can direct you to the proper place to deal with it. Because if you have the symptoms and you wait, then you can be buying into problems that you don't need to buy into.
Thank you so much, Charlie. Professor Benrimoj, thank you so much for joining us today. We really appreciate it. And Dr. Jan, any last words?
Look, I just want people to keep in touch with their pharmacists, because that relationship's one that could actually save your life. They help check our medicines. They make sure that we understand what medicines work with medicines, and particularly because we know some people may see more than one doctor now, making sure that the medicines that our different doctors prescribe with the best of intentions are safe for us to keep taking. So our pharmacists are a really key part of our healthcare system, and that building of a relationship with pharmacists can really help you as you move through life. So community pharmacy, a huge resource, really important, and their role is, increasingly important as a place to be vaccinated, as a place where your teenager can be vaccinated if they've missed their vaccines at school, as a place where you can seek additional health care. So please keep an eye out for the new services that are being available in community pharmacies. It's an exciting development, and we're very excited to be part of this.
Thank you so much, Dr. Jan and Professor Benrimoj, and to all of you for joining us today. We hope that we learned more about pharmacists in the community pharmacy trial. And if there are any questions you have, please send us your questions and we'll get them answered by Dr. Jan or Professor Benrimoj. But meantime, we'll see you again next fortnight. Next fortnight, we hope to get a special guest, and we'll keep you informed. But meantime, please, you'll see the recording of this session on your email and on the Multicultural Health Communication Service website. Take care of yourselves, and we'll see you again next time.